Hello, Dr. Jane. My name is Naomi Belgrave, and I would like to ask you a few questions about the coronavirus and how it is affecting the KidzCare staff. We are hearing about the pandemic caused by the coronavirus and would like to know how KidzCare is dealing with the situation.
Hey Naomi, thank you for that question. We at KidzCare Pediatrics are here to take care of patients. We are open. We are taking care of children, infants, toddlers, children, teenagers, like we have been doing since 2003, the day we opened the door. So yeah, we know we are in the middle of pandemic, but it's no different than any influenza season, uh, with more seriousness that the spread and the treatment available options are limited. But we are here taking care of patients like we do every day.
How are we screening high-risk patients?
I think KidsCare has made a policy that if you have a patient who's calling in for an appointment with possible symptoms of flu or a coronavirus like cough, cold, running nose, fevers, and or they have been exposed or they have a high risk and they have been exposed and they're concerned about coronavirus, if they're calling in, then we're asking those patients to come in when they come in to stay in the parking lot and to check in through their phone. And we have isolated one room in each office for these high-risk patients, and we are trying to bring in these patients from the backside door if it's available, or if there is no backside doors with straight access to a room which is in isolation, what we have called an isolation room within our practice. Then in that case, we can ask them to put a mask and give them good hand sanitizer, and then bring them in and take them straight to the room from front door. We are also asking those patients to stay in the car, and some of our offices and our providers and the nurses and the medical assistants are triaging those patients in the car, so we don't expose the healthy children. If they are truly very high risk kids, then we are in treating them and triaging them in the car and then doing appropriate testing.
In addition to this, what are we doing to minimize the spread and what are we doing to protect our team?
The obvious answer is if you have a very high risk patient with a serious exposure to a direct coronavirus, or if they've been to Italy, travel with China, Italy, European countries or Iran, where there's a very high exposure, or if you've been to Washington, Seattle area within the United States, then we want those patients to stay in the car. We want them to have the hand sanitizer, put them a mask, bring them from the back door or the front door, or stay in the car. And same way we want our team members to use sanitizer and good personal protective equipment, hand gloves, face masks, gowns, and whatever we can to protect ourselves.
As we know, there's a supply shortage, and we'd like to know how we're handling the supply shortage.
I'm sure all of you have heard in the news and probably seen that you go to a grocery store and you're not finding toilet papers. The same thing is happening, that there is a shortage of gowns, shortage of face masks, and we may eventually run into some shortage of gloves and personal protective equipment, which normally are stored adequately at most doctors' offices, or most of distribution, or most manufacturers are running shortage across the world, across the United States. So we do believe at this moment we have adequate supplies, and we have ordered it from our suppliers, and hopefully we should never run out of them. In case we do, then I have created a separate video in terms of how we can use the existing things like trash bags or garbage bags and Ziploc bags to create some personal protective equipment, and using surgical spirit instead of the sanitizer to wash hands. So there are many ways you could do things to protect ourselves.
Are we testing for the coronavirus at KidzCare?
Yes, we are using commercial labs, and without promoting any particular lab, we're using Quest, LabCorp, Diatrix. So those are the labs which have sent us or are continuing to send us the medium required to transport a nasal swab taken from a patient. So yes, we are testing this now at KidzCare, and most of the labs across the country are equipped to handle the testing.
In the cases where we are testing, do we have to report potential cases?
Yes, so if we are First and foremost, if we are having these patients with symptoms, then we are testing them for a flu first, because that's what's going around right now across the United States. So if they are negative for flu and they have been exposed to somebody with coronavirus, or they have traveled, or there's some kind of high risk exposure, or something to suggest they could have potentially coronavirus, we are testing those samples, collecting it and sending it to the lab. Then once 24 hours, we should get the results. 48 hours, we should have a confirmation. And if it's confirmed, then not only the lab will be reporting to CDC and NC DHS or Georgia Medical Health Department, and we will be doing the same reporting.
Will KidzCare remain open?
Yes, we will continue to remain open and provide service to our patients when they need the most. This is a national emergency and it's a pandemic. That means at this moment we need to stand up, step up, and do what we always do. We as medical professionals always have been doing our job, and we're going to continue to do the job. Every day, any patient could be exposing us to any kind of illnesses. So today is no different, except that we're going to take an extra precaution to be protecting ourselves and our team members.
Will we continue to get paid, and what do we do if we fall sick?
We will continue to get paid. Yes, we are open for business. We are going to take care of our patients, and we are going to make sure that every employee